We are right at 2 o'clock, so let's begin this webinar. Hello, everyone. I'm Coletta Dorado. I'm the founder and CEO of AZZLY. Thank you for joining us for Accreditation for Behavioral Healthcare Programs, Making the Right Decision. AZZLY is proud to continue offering complimentary webinars on important topics for behavioral health and addiction treatment providers. Accreditation is an important benchmark, as we well know. It ensures your organization adheres to rigorous standards, and it promises a high quality of care and prioritizes patient safety. This elevates the standard of care and fosters trust in this healthcare sector. Our objectives today are to dive into the accreditation and what it can mean to your organization. We got a pretty big list here. We're going to do our best to cover it all today. If you have any questions for the panelists, please enter them through the Q&A feature in Zoom. We will have time at the end of this webinar where we'll answer these questions. As well, we are sent a big list from those that are attending, and that's what we're going to try to cover throughout this webinar and then also at the end. So we're grateful today to be joined by Accreditation Guru. Accreditation Guru is a nationally recognized consulting firm, AG as they go by, short now, with behavioral health, child and family service and education organizations are who they serve across the U.S. and internationally to achieve and maintain accreditation standards that are mandated out there. So our panel includes Jennifer Flowers. She is the founder of AG and CEO. I met Jennifer probably about 8 years ago at the Joint Commission Annual Conference in Chicago. She and her consultants serve these treatment facilities in helping them meet these standards that aren't always easy to attain, but they're excellent and thorough in the work that they do, and they do get agencies accredited depending on those agencies that they select. So I go back quite a ways with Jennifer and her team. Now, Peggy Lavin, LCSW, Peggy is a director of behavioral health at AG. I met Peggy at the same conference, but she was high up in the Joint Commission's management. She has a great wealth of knowledge from and really hands-on on the clinical perspective of behavioral healthcare settings and programs. I was really happy to hear when you joined Jennifer and her team. I thought, wow, good for Jennifer.
Thank you. I was very happy as well.
I bet you.
And I'm happy.
Yeah, you both, every time I'm on with you, you're smiling. So it's got to be working for sure. So thank you both for taking the time today and joining us and really sharing your knowledge. It's such an important topic. So let's begin with, let's see, Peggy, since I've got you front row and center. What are the unique aspects about accreditation for the behavioral healthcare segment of specifically?
I'm going to start with the basics, kind of the low-hanging uniqueness. So 2 basics. Each accrediting body puts their accreditation requirements in a manual, and those requirements are called standards. And there is a separate, unique manual for behavioral healthcare accreditation, different than physical healthcare, hospital or laboratory, or so on and so forth. And the other basic uniqueness are the surveyors, the people that come to check if you're operating in compliance with those accreditation requirements. They are administrative or clinical behavioral health care professionals. So social workers, counselors, psychologists, administrators of group homes, residential treatment centers. So those are the low-hanging uniqueness. But I would like to mention behavioral healthcare accreditation has a more in-depth emphasis on trauma-informed care. So the accrediting bodies look for a screening of what adverse life experiences a person has either experienced or witnessed, and how does that impact their behavioral emotional functioning. And with this data, how does that inform the treatment planning process for that particular individual? I would also mention that behavioral healthcare, in my opinion, promotes recovery concepts. Just a couple of examples. So the recovery concept of empowerment. The accrediting bodies expect to see that the person served is actively involved in the whole process, from admissions, screening, assessment, treatment planning, monitoring their progress, and certainly in discharge planning or transition to a different level of care. Individualized, person-centered care is a recovery concept and it certainly is embedded throughout the accrediting body's standards and requirements. Strength-based, identifying what are the strengths identified by the client, the family if appropriate, a teacher, whomever, and then build upon those strengths. And the final recovery concept I would mention, supported by accreditation, behavioral health care accreditation, is peer support. People with lived experiences helping people in recovery. And the accrediting bodies, and these are fairly recent, have developed peer support standards that provide a framework for integrating peers into the treatment team and providing quality services.
You know,
Jen, do you have anything you want to add?
I think you covered it really well. Good job.
Okay,
Kate.
thanks. Thanks.
You know, it's interesting that you mentioned the peer support, because we are seeing more and more organizations adding that to their program offerings. And it's great to hear that those standards have been created and put forth for them to follow. But Jennifer, you know, I should back up, because there's some that have joined that maybe don't even know what accreditation is. So explain, Jen, if you would, what accreditation is, and the accreditation bodies that are out there, the Joint Commission, CARF, COA, you know, how are they different?
Sure, definitely. So for those that aren't familiar, I'll keep this as kind of at a 10,000 foot view. Accreditation is the process of taking a service provider through an independent third-party review by an accrediting body or an accreditor. And the accrediting body is there to assess conformance and how the organization is implementing the standards that they have written. And Claudia, as you mentioned, in behavioral health, the big players are the Joint Commission, CARF International, COA accreditation, which is now a service of Social Current. And there's other ones out there. ACHC is another. They all tend to have an approach where they're looking at the administration management of the organization and also the services and programs. It's important to know that the accreditation standards, I mean, Peggy was talking about these with the peer support standards that are newer and come in. Each accrediting body has their own unique set of standards, and those standards are reviewed on an ongoing basis and generally once a year, unless otherwise needed. They will update their standards. Sometimes that can be a small adjustment, or maybe adding in something like peer support, or they might decide that we're going to change our human resources and training and supervision to become workforce development. And that can be a complete transformation of that section of the standards. When an organization goes through accreditation, they're going through an on-site survey where the surveyors come. They will look at the facilities, look at your policies and procedures, do an audit of your clinical files, and go through the entire process to see how they're implementing the standards and how they're in conformance. There is an expectation that an organization is proactively maintaining their accreditation once that survey is done and the accreditation has been granted, and then they have to go through a full review every 3 or 4 years. And during that in-between time too, they have an annual report. There's some items that might trigger self-reports, et cetera. So I don't get in the weeds too much. But that's kind of it. It's helping an organization to go through this review. It helps with their reputation, focus on quality, focus on risk management, strategic planning, quality of clinical documentation, et cetera.
Jennifer, just to follow up on what you just said, is there benefit to accrediting with more than one?
The short answer is no. And I actually get asked this, and it seems I'm asked a little bit more often these days. really, and I've told organizations, and while we are accreditation consultants, one might think we might encourage someone to go and get multiples because we can then help them each time. But generally, selecting one accrediting body is all you need. That will satisfy any state or federal mandates, deemed status, payer requirements, or even if you're not doing accreditation because of an external reason, just internally, you decide that you want to have that commitment to quality, have the surveyors come on site and really take your organization above and beyond being licensed. So one accrediting body is generally enough. The thing that I've been seeing more recently in behavioral health is there are a couple of big players out there that have, say, gone for both Joint Commission and CARF accreditation. And so others are thinking, well, I want to get the same 2 or even 3 that this organization has so I can, be on the same level. Multiple accreditations add cost. It can add confusion to your staff. There are different standards. You're going through multiple survey reviews. And again, it really doesn't add anything. So my general answer is there's not benefit. Of course, if somebody wants to have multiple accreditations and that's their decision, we can help them, but I don't encourage it.
Great, thank you. Very honest feedback. So Peggy, what should treatment centers have ready before accreditation? Is there any kind of a checklist you'd recommend?
So most of the accrediting bodies have some free tools and some for sale tools. And I think they include checklists. In terms of what we do with our clients, we create a accreditation calendar that charts out the milestones that need to be achieved to be successful. And we do a unique work plan. So rather than kind of a generic work plan, it's unique to the client's program, services, populations, that type of thing. But I will tell you that what I consider the 5 big checks to get ready. And that is, you need to know your baseline of readiness. Where are you starting? How compliant are you from the get-go? We have a free readiness assessment survey for both initial accreditation and reaccreditation. And we also do a free consultation. So we help people figure out the baseline. Second big check is crosswalking your policies and procedures to the requirements. For initial accreditation, what gaps do you have? Because they have to be filled. But even for reaccreditation, you want to pull them out and check them because things may have changed in operations, clinical or administrative, and no one thought to go back to the written plan or the written policy and make those updates and get the official approval. So crosswalking your written plans and policies are very important. I think I'm on 3 and 4. You want to, and Jen mentioned this, you want to do a careful review of your clinical records and your personnel files. Are you doing all the clinical processes required? And are they documented in the clinical record? Are you doing all the human resource, the workforce development processes required? And can you see it in the personnel record? And finally, the big 5 checklist, and this is a big deal, is you have to assess your physical environment. Is it, no matter if it's an office, a group home, a campus for residential treatment, you have to assess it for safety, security. Is it healthy? Is it well maintained? And is it therapeutic? Is it an environment where people can change, grow, and develop? So that's my big 5 checks for a checklist.
And I definitely agree. And Coletta, if I can just add in 2 quick points there. One, going with Peggy's first side and with the readiness, there are some organizations out there that will think, well, we just went through our licensing review and passed with flying colors. So accreditation, we're just going to, add it on and take care of this. Accreditation is entirely different from licensing. There are more standards. They look at a broader and more in-depth view of your organization. And a tip, groups going for accreditation first time often find out they have to do more work on the administration management side of their company, because that has typically not gone through an external review. You might have all your policies and procedures and should for your programs and services, but what is going on in HR and in finance and around your risk controls, et cetera. So just because you are doing well in licensing doesn't mean that accreditation is going to be easy for you, but obviously it gives you a head start. And going to the last point with the facilities, you want to check the facilities early on in the process. And I always recommend that you have someone, not your facilities manager, go through and make the check. So a different staff, or bring in an outside consultant for that fresh set of eyes. But if there are issues, and sometimes there can be some major issues that need to be taken care of, you need to have the budget and the time to make those improvements before the surveyors come on site.
Well, it's a lot of work. I can see why you recommended, why would you do two, do one and do it well.
Yeah.
Okay. So talking about the selection of one, if you were just offering mental health programs versus a organization that's offering the dual diagnosis, the mental health, behavioral health, the substance use disorder, is there a preference as far as guiding them which organization may be best, which of the CARF or the Joint Commission or COA may be best, depending if they're pure mental health?
I would say just because of that distinction, you are not automatically leaning toward one accrediting body or another, because they all have standards that speak to those different services, and then have the standards that speak to the administration management. So no matter which one you're working with, the whole organization is being reviewed, and certain standards such as performance improvement, emergency and disaster preparedness, screen for suicide risk using a standardized tool, that's going to be applicable regardless of what your services are. But then there are standards that will drill down into if it's just mental health services or anything that you might be offering.
Great, thank you so much on that. So Peggy, let's go back to you on the mental health care policies. And it's been a roller coaster the past few years. Are you seeing any shifts in standards? You mentioned the peer, but are there any changes that those that have joined today should be aware of going forward, that you've become privy to, or you have a sense?
Mm-hmm. Well, I have to start with the pandemic,
Right.
the impact of the pandemic. As we all know, the whole world pivoted very quickly to teleservices, food delivery, and not just in behavioral health care, but in all types of services. And but behavioral health care organizations had to do that pivot very quickly to start, to support the people in treatment. There wasn't in person, they had to go to telehealth. And accredited organizations did very well with that, because the telehealth standards of the accrediting bodies helped them shift quickly and maintain the quality. And even now, as we're ending the pandemic or coming out of the pandemic, I read both opinions. Telehealth services are going to still be part of the service delivery. They prove to be very successful in any number of ways. And so these standards help you either develop or strengthen your telehealth services, but also in terms of keeping quality of care. I would also mention, it used to be that behavioral health care organizations did mental health and substance use disorder treatment, and physical health care organizations did physical health care. But we are seeing more and more behavioral health care organizations that for a long, long time just did behavioral health. They are integrating physical health care into their programs. And there's a lot of interest in that at the state and federal level. So there's a lot of drivers to do that. Once again, accrediting bodies have standards that give you a framework to be successful in that integration and to provide quality care. Jen mentioned, the other thing I wanted to mention was new standards for addiction providers. One example of this is CARF now has a certification that's separate and distinct from accreditation for ASAM level of care certification by CARF. And this is available to CARF accredited organizations who are accredited by anybody or not accredited organizations. So it is very separate and unique. Joint Commission has recently, in the last couple of years, strengthened and added new requirements for addiction providers. Two examples, multi-dimensional assessments and policies on drug testing. This kind of emphasizes what Jen said earlier. You have to keep up with the new and revised standards as they come out and start implementing, and certainly have to have them implemented by the effective date. Jen also mentioned that some of the standards can be challenging. And one example I would give to that is the, and Jen mentioned this, determining suicidal risk using a standardized instrument and challenging. I just want to mention Joint Commission, I think for the last couple of years have named this as the #1 most cited standard in initial and reaccreditation surveys. So organizations are struggling to demonstrate compliance, to get into compliance with this. So those are kind of some of the shifts I'm seeing.
That's excellent. Jen, any additional comments there?
I think she hit most of them, and just again, keep in mind that the accrediting bodies are researching, field testing, vetting their standards. They want to keep up with current, not trends, but practices, best practices. And you will be held accountable to new standards along the way, and when you go through your next survey.
Okay, excellent. Well, thank you both for sharing your experiences. It's obviously a benefit to be accredited. And, you know, we just did recently a credentialing webinar and got tremendous interest on that as well. So it appears to me, and I'd like both of your feedback on that, to go through accreditation and have support of an agency like AG, an organization like AG, to stand next to you, would you say that that would be a great benefit for credentialing a facility? Is if they have that Joint Commission badge or CARF badge or COA badge, that they've gone through this rigorous process?
You want to start with this one?
Sure, I'd be glad to. I definitely think it's a great support because the requirements of all the accrediting bodies support credentialing to make sure that people are qualified and competent. And it's not just that I get to say I'm a licensed clinical social worker in the state of Illinois. The organization is responsible to check with the Illinois Department of Professional Regulation and make sure that I'm in good standing, that my license is active, and have proof of that. So the accreditation requirements require documentation of qualifications, competencies, so the abilities to perform assigned tasks. So a lot of that documentation required for accreditation is exactly what's needed when you're working with credentialing of payers. Sometimes it's a challenge to find out how to do that, although computers have made it much easier. And you know, we have worked with a number of clients to help them with credentialing for payers, or definitely, of course, meeting the accreditation requirements of all the accrediting bodies.
Excellent, great, thank you. So a question on the services that you provide. If an organization, if a treatment center is having difficulty with a surveyor, do you come in and work with them during the whole process as far as supporting and giving them assistance?
Well, the surveyor is only on site for the review process itself. We generally work with our clients and set them up so that they are fully prepared. They've gone through mock interviews, documentation is ready, facilities are ready, so that they don't need us on site or, you know, holding your hand, they're backing up. obviously, if something goes on and there's a concern, we will talk to them and give them tips. Maybe a surveyor is not finding documentation and saying that something is not existent, but we can coach them on, well, no, this is how you should present it to them and kind of get over that hurdle. Excuse me. But we will certainly coach them through. But
So
yeah, generally
really
they're all set. And it's actually funny, when we do mock surveys, we're rarely told that we ask tougher questions than the accreditation surveyors actually do. So our clients are ready.
That's actually
Well prepared.
Yeah, well prepared. I get it. That preparation factor is invaluable. How long does it usually take? That's one of the questions that came in. The process.
And we get asked that a lot, understandably. It does depend a bit on which accrediting body you select. It depends on your state of readiness. It also very much depends on how focused you are on the process moving forward, staff availability. So generally, a group might consider 6 to 12 months. Some working on their own may take longer. One note is that both CARF and COA require that you are in conformance with their standards for at least 6 months before they come on site. The Joint Commission does not have that 6-month look back, but you still have to do the work to get ready and come in conformance with the standards. So
Wow.
6 to 12 months is kind of a general answer.
Okay, very good. Thank you so much. Here's another question. Do you often find an accreditation body saying they are not accepting applications at this time?
I've never come across that. And Peggy, I don't know if you had ever seen that.
You know, I did hear recently someone say this, but it was because they did not give themselves that 6-month track record. So they needed to be accredited in less than 6 months without having the compliance track record. So at least one of the accrediting bodies said, but you don't have the track record we require, so we're not able to accept your application, which I thought was a very honest approach. But that's the only thing I can think of even related to that question.
I can see that if somebody's running up against a deadline. But even when there are federal mandates that have been put in place, I mean, well, like Peggy, worked in the accreditation field kind of forever now, and have seen a lot of mandates go in. It's really important that if that is coming, and the trend is there will continue to be more mandates and establishment of deemed status, that an organization gets out ahead of time and gets accredited as early as possible. So beat the rush, because there are times that the accrediting bodies will still accept your application, but you might not get a survey for months and months and months because you have all these other entities in line ahead of you. So.
Yeah. I remember there was a period of time when it took a long time
Yes.
for the commission to get out there because they were buried. They were buried. Peggy, you were probably there during that time.
Yeah.
So we only have a couple more minutes. Here's another question. What is the best, in your opinion, best accreditation organization for a medium-sized outpatient substance use disorder and co-occurring treatment center? Is there a one that you think is better, CARF, COA, Joint Commission, for a medium-sized? It doesn't matter.
Peggy, you want to take that one?
Yeah, I would say, I don't know that I would say there's a best, but I think the most often selected, particularly when there's substance use disorder treatment provided and medication management or medication use, is CARF and Joint Commission. I mean, I just think that they're the two that are selected most often. And people seem to be very happy with their process, whichever one they select. And the payers seem to be very happy with whichever one they select. And that's the thought I have for that question.
I agree.
Great, thank you. Well, thank you both. We're bucking up into our half hour. I thought it was a great discussion. I certainly enjoyed it, and always learn quite a bit when I'm in a room or on a webinar with you all. We still have several questions that didn't get answered, but we'll be sending out responses. We may be reaching out to obviously both of you to help in that response, but please, if you have any additional questions that came up based on this, we have a couple. How often is accreditation updated? We'll sneak one more in.
But the accreditation standards that's we're referring to, generally, it's once a year. They will roll out their accreditations. And one other thing on timing, Joint Commission and CARF have a 3-year cycle. COA has a 4-year cycle. So it's every 3 or 4 years you're going through a full review.
Okay, great. That's the last question I'm going to take here and get these answers out. If you have anything or any additional questions that AZZLY can help with, it's hello@AZZLY.com. I want to thank you. I want to thank all the attendees, number one, for taking the time out today and joining us. We'll continue to offer webinars on topics that we feel are relevant to behavioral health and substance use disorder. I really want to thank Jennifer and Peggy for your time today. It is always a pleasure. You're just probably two of the most knowledgeable individuals that I've ever come across when it comes to accreditation. And I really think you do such a great service in really raising the standards that are in place and best practice in all that you touch. So really keep up the good work, and glad to have you on board. We've got our next RCM webinar is going to focus on prior authorizations, which is always a fun topic to speak about. So follow us on Eventbrite. Thank you for your time today. Andrew, as always, stellar job, and Lainey and Rebecca and the whole team at AZZLY and
And thank you, Coletta. Thank you, AZZLY, and for everyone who joined today. It's been a pleasure.
Great. Thank you all.
Thank you for inviting us.
You're welcome. Bye-bye.
Bye-bye.